Thank you for taking the time to watch this training session on helping to manage acute gastrointestinal disturbances. My name is Laura Hughes and I'm the Veterinary Nurse Development Manager at Purina. So today we're going to cover a few different areas. So firstly, we're going to look at why are we focusing on acute gastrointestinal conditions. Then we're going to look at understanding how do we know when it's an acute condition. We're going to look at an overview of the digestive system. We're going to look at an approved acute GI decision tree. So this is a way for you to be able to triage and manage those clients that call up with an animal with either vomiting or diarrhea. You can work through this process to try and determine if that animal needs to see the vet or whether you may be able to recommend some probiotics and gastrointestinal diets. We're going to touch on why we would or wouldn't want to use chicken and rice. And then we're going to do a short snippet on the ProPlan veterinary diets, the core gastrointestinal range, specifically looking at our EN, which is our gastrointestinal food, our Fortiflora, which is our probiotic, and our Hydrocare, which is our hydration supplements for cats. So first of all, we're going to think about why are we focusing on the acute GI conditions? Well, acute GI conditions are one of the top 3 reasons that an animal is taken to the vets. And actually what we do know is that every member of the veterinary team can help make those recommendations and support those owners during this time. 90% of all owners want to receive a nutritional recommendation when they visit the vets, but only 15% perceive they do. Now, we know the reality is that's a perception because sometimes owners don't see that we're being explicit enough with our conversation around nutrition. But what it really shows is that they do want to have that conversation and get that support from the veterinary practice team. So first of all, how do we know if it's an acute condition? So an acute gastrointestinal condition is often anything that is a duration of up to 3 weeks. Anything longer than that period or those that are persistent or reoccurrent are then classed as more complex gastrointestinal conditions. And that's certainly when it's really important that they have a review and appropriate follow-up with the vets to see how that condition can be supported from a long-term perspective. So first of all, I just want to do a bit of an overview of the gastrointestinal tract. It's important for digestion, but also many other things as well. So if we kind of we start off at the mouth. We've got the mechanical action of chewing the teeth. You've got the production of saliva that starts to break down some of the food in the mouth using enzymes. The food then travels into the esophagus. And so the esophagus is a muscular tube, and that uses an action called peristalsis, which is a contraction to help push that food all the way down into the stomach. Then you've got the stomach. I always describe this as it's a bit like a washing machine. So all of the food is going to be mixing with the acids, all of the other enzymes in there to start breaking down those foods into the individual nutrient components that they are. You've got the liver and the pancreas. So these are kind of additional organs that have a part to play within the digestive process. So the liver produces bile acids that help to break down fats, and the pancreas produces certain enzymes that again are helpful for food digestion, but also controlling hormone and blood glucose levels. You've then got the small intestines, and the small intestines is the kind of main hub of nutrient absorption. So this is where a lot of the absorption of nutrients happens. And then you've got the large intestines. So the large intestines is really important for gut transit time, so how quickly things are moving through, but also reabsorbing some of the water from within the feces. So this is our decision tree. So this is something to have a conversation with your clinical director. If you are watching this through our vet centre website, please have a conversation with your clinical director and share this with them before you implement it for your reception team. But this is a way of looking at, if I've got an animal with diarrhea, whether it be a dog or a cat, you can kind of work through these questions with the owners, and then based on the answers, you can then make a decision decision as to whether they do need to see a vet or a nurse, or whether they could be given some acute gastrointestinal support in the way of nutrition, and kind of told to kind of monitor them and keep an eye, and come back to you if there's some concerns. And the idea being, we know that appointments are a premium. And so they tend to be filling up very quickly, and it can be quite difficult to get these appointments in. And actually, we know that for a lot of them, they will resolve with a gastrointestinal support from a nutritional perspective. So actually, for those ones that are still bright and happy within themselves, it may be appropriate to use a gastrointestinal nutritional plan to support that patient rather than them needing to come in and take that appointment. You will also have situations where the owner can't physically get the animal in for whatever reason, and you want to be able to recommend something. So from a kind of tools perspective, we've got a printable version of this gastrointestinal decision tree. So if you would like a copy of that to be able to take your clinical director through, then please let us know and we can get that sent over to you. But we also have the fecal scoring chart. So this tends to be a bit of a marmite of a tool. Clients either love it or hate it. There doesn't tend to be much in between. But it's really helpful if you've got a client that's saying their animal has got an upset stomach, to use this to determine how severe it is can be really helpful. It's also a great tool to use for kind of normal everyday nutrition conversations, because if you haven't got a nice well-formed poo, that could suggest that that animal isn't digesting the food as well as they could be. And that's where in those situations it might open up the opportunity to have that conversation. Now, depending on what your clinical director decides from how this gastrointestinal decision tree would be managed, the idea being, if there is a recommendation that based on the answers to the questions when you've worked through that gastrointestinal decision tree, you can make a recommendation of some probiotics or gastrointestinal food, for example. The idea is that we have our acute gastrointestinal feeding tables. And so this gives you the ability to, for each animal as an individual, look at the size and their weight that they are and give them the appropriate recommendation for gastrointestinal food, so that they've got a 3-day supply at least, but ideally a 5-day supply. I know for some practices, they would prefer to take a kind of more uniform perspective. So they would look at having a standard pack made up as an acute gastrointestinal pack with X amount of pouches for cat and X amount of cans for dog, and maybe a small bag of the dry if they're dry food fed. So that's something to have a conversation with your clinical director, and they can then obviously make the decision whether they want to follow the specific recommendations to give the client a 5-day supply of that food, or whether they want to have a kind of generic pack ready within your clinic. So, do we want to use chicken and rice when we've got acute gastrointestinal answers? Well, the quick answer is no, because there's no feeding guides on chicken and rice, and we don't know what is the optimal ratio of chicken to rice. It hasn't been specifically designed to support the gastrointestinal tract to recover, and it's lacking many nutrients. We also know that there is a real variable quality associated with chicken and rice as well. So I always use the example of, is it a Tesco value chicken, or is it a Tesco finest chicken, because actually the quality of that chicken may well be quite different. We also need to think about, do the owners have the capacity to make up the chicken and rice? When we talk about chicken and rice, we often talk about boiling chicken and rice, but actually do owners understand that that's what we mean? We've had examples in the past where people have done crazy things like feeding their dogs with gastrointestinal upsets Nando's, and thinking that that's acceptable. Or we had a KFC one we had, which I think was probably my worst, was a chicken tikka and rice, one of the ready meals. And so again, that's really not suitable or appropriate. So it's really about understanding that, but also thinking about the clients as well, because they not only might they not have the capacity and the time to make this up, do they have the ingredients in stock? If they don't, they're potentially going to need to go and shop for those. And do they have the ability to do that if they've got an unwell dog in the car with them, or cat? But also, are they comfortable to cook up chicken and rice? If you've got an owner that is a vegan or vegetarian, do they want to be cooking up chicken and rice for them as well? The other question we often get asked is, should we be starving these patients? And the quick answer is no. Unless you've got an animal that cannot stop vomiting, you shouldn't be starving them at all, because we know that it is the food that enters via the mouth, so we call it enteral nutrition, that helps to support the recovery and the repair within the gastrointestinal tract. So it is the nutrition that comes by mouth that needs to support giving the small intestines and the gastrointestinal tract the nutrition it needs in order to be able to work through that repair and recovery. So now we're going to go on to our core gastrointestinal range. So, as would make common sense, the main product that we would be reaching for is our Purina gastrointestinal diet. The nice thing about this diet is we have both wet and dry options available, and within our feline range, we have the can and the pouched product. The difference with those is the texture. So, the pouches are a shredded in gravy texture, whereas the cans are a bit like a coarse pate. When you go to the dog product, we've got the dry, and we've also then got the kind of firm mousse, which is what the can is. We also have our hypoallergenic diet, which is suitable in some cases. And then we have our Fortiflora, which is our probiotic, and then our Hydrocare, which is our hydration supplement. So to look briefly at each of those diets, so our EN is the diet that's designed to manage intestinal disorders in both dogs and cats. So when we look at these products, the wet product is only suitable for puppies for up to 5 days because it isn't nutritionally complete and balanced longer term. But for those acute GI cases, the wet could be suitable. But if you've got something that is potentially a more complex gastrointestinal condition, that's when you would be looking at the dry only in a puppy. Whereas if you've got an adult dog, it could go dry or wet from a long-term perspective. Now, this diet is a diet that has a moderate fat content, and those fats also contain medium chain fatty acids. They are much easier for the body to break down, so there's less processes for the digestive system to have to work through, which is really helpful when you've got a compromised gut. And it is also it's very highly digestible, which means that it makes sure that everything that goes in, as much as possible, can be used, and therefore the digestive system isn't having to work as hard. So we then have our feline range. So it does work slightly different to the canine range. So we still look at that high digestibility and low residue, so reducing that load on the already compromised guts. But for our feline product, we have a limited number of protein sources, which is particularly helpful if you're suspecting there may be a food-related response. We have the addition of prebiotics, specifically inulin, and that helps to feed the good bacteria in the guts and help with that positive gut balance. Additionally, we've got things like omega-3 fatty acids, and we've got the STOX claim on there as well, which is minimizing development of struvite and oxalate. Prebiotics also help with gut transit and balance, and we've got our omega-3 fatty acids to support the anti-inflammatory processes, and insoluble fibers to promote the regularity of the gastrointestinal tract. So we then have our Fortiflora. So our Fortiflora is a probiotic. So that is a dose of the live bacteria. The difference with Fortiflora is that it's microencapsulated. So the easiest way for me to describe this is if you imagine an onion that's got lots of layers, the microencapsulation that we have around that live bacteria is layered. And so as that probiotic works through the digestive system and all of those harsh processes that I talked about earlier in this session, what you find is that the layers of that metaphorical onion peel away, so that by the time that probiotic gets to the intestines where it's needed to do its job, it's still live, intact, and able to do what it needs to do. So the whole point of a probiotic is to try and restore the gut balance. So we know that 70% of the immune cells are located in the guts. So if you've had a real severe upset stomach, that does impact the gastrointestinal balance. So the analogy I often like to use is if you think about the worst upset stomach you've ever had, you'll remember it probably very clearly. And what you'll remember is you had 24, 48 hours where you had the physical signs of that gastrointestinal upset, but then you had 2 or 3 days afterwards where you still felt a bit run down, maybe a bit cold and fluey and achy. And that's because the immune cells within your guts have taken a literal beating, and it takes them a few days to get back up to full working order. So by supporting that gut balance, we are helping that overall immune health as well. The really nice thing about the Fortiflora is it's 1 sachet per day, regardless of size. So if I took the dog product, for example, it doesn't matter whether you're a Great Dane or a Chihuahua, you will have 1 gram sachet per day. So it makes it nice and easy. When you look at the Fortiflora, it is a brown hydrolyzed digest with the little white dots. The little white dots are the microencapsulated probiotic, and the brown powder is a hydrolyzed digest. To you and I, it looks a bit like gravy granules and smells very meaty, but that is also what encourages the dogs and cats to eat it as well. And that's what it looks like in case you haven't seen it before. And this one here is just showing you what the encapsulation looks like if we were to break that up. So last but by no means least, we've then got our HydroCare product. So this is our hydration supplement for cats, and it is a nutrient-enriched water containing osmolytes. So in case you haven't heard of osmolytes, they are molecules that help to regulate water movement across the cell membrane. They come from whey protein and help to increase hydration and urine dilution in cats. So we know there are many conditions where cats may benefit from higher fluid intake, such as kidney disease, urinary problems. But from the purpose of today's presentation, we'd be looking at things like constipation. So helping the cats with the hydration will help to soften those stools and help with that. So it is a soft liquidy jelly. When I describe it, I will often say it's a bit like the consistency of gravy, although sometimes that may start the argument as to how thick or thin gravy should be. But what I would always say is it's thicker than water, but it's not a firm set jelly. So it has got some substance to it, but it's not quite as thick as a set jelly. Now, the idea is that this will encourage cats to voluntarily drink more water. And the studies that we've done found that cats will voluntarily drink up to 50% more water when they're on the HydroCare versus when they're just on water alone. And that's really significant when you think about how ineffective cats are at drinking. It also has been shown to dilute their urine. So again, for cats that are very good at concentrating their urine and not going to the toilet, it's a really good thing because it helps to encourage that as well. And because it is this great tasty jelly, it encourages them to lap it up and therefore reap the benefits of it as well. It's 1 pouch per 2 kilos of body weight per day, and that will support those cats either where hydration is a concern or in situations like constipation. So thank you so much for taking the time to listen. If you have any further questions, please reach out to us on email at vettechline@purina.nestle.com. That's vettechline@purina.nestle.com. My name is Laura Hughes, and I appreciate the time that you've given me today. Thank you.